Great. Hi everyone. Those of you in person, if you're still grabbing your food, no worries. We're going to start in a minute or so. For those of you joining us online, a very big welcome. My name is Sara Brown, and I'm the Health Equity Lead here at Stanford Biodesign. And this is one of our Health Equity and Innovation Series talks. If this is the first time you're joining us today, especially for those of you online, this is actually a whole series of talks where every month we have a different conversation about important concepts related to health equity and innovation, and really catalyze conversation and community around really important subjects in this domain. So just some housekeeping before we kick off today. For those of you who are unfamiliar with our buildings, the restrooms are through this door, to your left, to my right, and through the second door. There's two restrooms there. Please could you ask you to put your phones to silent for the duration of the talk. And please feel free to help yourself to snacks. Ideas, this should be a conversational talk and not a lecture. We are going to have a decent chunk of time at the end of today's talks and questions, both our online audience and our in-person audience. Those of you online, please feel free to submit a question using the webinar question format. We'd also love to hear your name and where you're from, because we know we do have an international audience joining us online. And for those of you in person, also just feel free to share a little bit about where you're from and then your question. I'd like also to thank our partners. So these events aren't just done around Stanford Biodesign. It's also done with the Center of Innovation and Global Health, the Bay Area Global Health Alliance, and the Stanford Global Health Graduate Network for joining us. They help make these events possible, and we're ultimately all a community that really care about global health and health equity. Okay, so that's all the logistics. On to today's talk. Why on earth do we have a talk about measuring social value? So I'm going to dig into the biodesign part of that to frame the talk, and then Sarah's going to talk about, obviously, the content. But for those of you unfamiliar with biodesign, we're a methodology that helps innovators think critically and systematically risk a lot of unmet needs to decide what to pursue. And part of the strength of the process is that we help innovators think through what is the potential financial opportunity associated with different unmet needs. But as our curriculum is evolving, we've now changed the way we think about that to not just think about financial opportunity, but also looking at the economic burden in terms of how big is this problem, not just what the market represents. And we're also looking at what is the effect socially, environmentally, and what is the potential impact. And a lot of our fellows at the moment are working on projects where they're at a concept development stage, and we're starting to ask questions about what is the potential impact. And so as we integrate all these concepts and trying to figure out how to always enrich and evolve our curriculum, we want to really start thinking about social value. Obviously, health is a topic where we think there's natural social value, but it's not as easy. To measure, it's hard. To know what to measure is hard, and to do it with the right partners, it's even more difficult. And so we're just really grateful to have Sara today to share her wisdom and help us understand a little bit more about this evolving space. So a little bit about today's speaker, Sara Olsen. So Sara holds an MBA from UC Berkeley and is the founder of the SVT Group, a pioneering impact management advisory firm and best for the world B Corp that supports clients to grow and tap social and environmental value. In the service of redefining profits that it takes into account people and planet's well-being, SVT's mission is to make impact management standard practice. The firm's work has been used to gain insight into and or manage the impact of some $10 billion in assets for clients, ranging from private equity funds to savings and loans, foundations, tech ventures, like many of us here, social enterprises, and nonprofits. Sara has also personally trained some 7,000 individuals in impact management impact measurement and management skills. A champion of emerging impact management profession, she serves as a board member and methodology co-chair of the Social Value International standards body, a network for professionals who are changing the way society accounts for value. A founding board member of SVI's US chapter and SVI's liaison to the impact management platform, which works to harmonize leading impact disclosure and management standards. So as you can hear from this really impressive bio, Sara is not only thoroughly well trained, but is also pioneering this field, because this field is changing so much. It's one of the fields I think we're seeing huge amounts of evolution. And so we're just really grateful for your time, your wisdom, and your expertise. And thank you for sharing with us today. I'm going to hand over to you for the next 35 minutes, and then we will have time for Q&A. So thank you.
Thanks so much. It's really a pleasure to be here with some friends and family and some new faces too. I see that you've been warned that I might bite, so thank you for if you need a seat and you want to come, that would be nice too. All right, so when I say moving beyond internal rate of return, I don't mean that we're going to leave internal rate of return out of what we're thinking about. That does matter. It's an important part of the equation, but it's just not the only thing. Does this work now? Okay, yes. So what we're talking about is the idea that it's not just the investor's value that matters. There are other parties experiencing value from every transaction, every business investment, every development effort. But our accounting system doesn't pick up on that. And so you will see a pattern that looks like this from above in every city in the world to some extent. There's somebody who has all their needs met and then some. And then there's a lot of people who do not and who are living in a very minimal way that's dangerous for them and others. So why is this happening over and over? You know, basically, a challenge that we all are dealing with is that our systems of accounting for value are looking at the financial transaction, financial benefits that are exchanged, but they're not thinking about all the rest of the value. So I just wanted to ask you guys, what other things do you value to get the discussion started? Is there anything besides money that is important to you in your life? And value and importance are kind of the same idea, right? So what else matters in your life if there is something? Yes.
Quality of life.
Quality of life. Yeah. Anybody else? Yes.
Community.
Community, feeling like you are understood and you're part of a group who are there for each other.
Peaceful mind.
Oh, peaceful mind. Yeah, I appreciate that. Wow, that feels rare these days. Yes.
Clean air, clean water.
Clean air, clean water, food that's healthy and delicious and maybe help the people who produced it to have a good life too. Clothing. You know, there's all kinds of things that we value. And how much of that is actually getting recorded when we produce our financial statements? Not very much. But now, and I'm here to give you a short summary of the history of the evolution of this field, so much more of that is actually entering the calculus that investors are aware of when they're doing transactions, if they want it to. And that's what impact accounting is all about. Impact management is the discipline, the management discipline of how you understand what effects you're having on society and people's well-being and the environment, and then make decisions to try to optimize your value creation, not only on financial terms, but also on terms that are good for everyone who's affected. Valuation is one of the tools that we use to make that happen, because valuation has the benefit of really enabling decisions in a way that just collecting and measuring stuff does not. And I'll try to explain why. So when I was in Chicago, when I was in my early 20s, I was working in a social enterprise. And we happened to be connected to one of the pioneering community banks called South Shore Bank. And we were therefore in the stream of the cities where a pioneering venture philanthropy group called REDF came to try to replicate their model of how they were investing to create value for people instead of returns for the investor, right? They were investing in small social enterprises that were employing people who had been homeless. So they were asking, what is the social return on investment? And I will always remember when we invited the founder of that venture philanthropy group, Jed Emerson, over to the University of Chicago, where I was doing my social work master's degree, to come and talk to us about what they were doing. And he told us about this idea of social return on investment, and like the clouds parted. for me. You know, angels started singing because I'm like, that idea is so transformational. Like, if you could actually calculate social return on investment for one thing, you could calculate it for everything. And if you could do that, then we would be able to tell something about how people are going to be affected by what we do with our money. And then we'd be able to use our money in ways that are not harming other people and maybe even doing good. And I think most people would choose to do that, although some days I'm less sure of that. But so that's what this is all about, is social value is about the value that's created or destroyed for people who are affected by an investment, including the investor, but not only the investor. And social value analysis and impact accounting are ways of describing how you would go about measuring and managing that stuff in a way that informs design decisions and investment decisions. So that's what SVT's work has been all these years. And it used to be that when I would try to explain that, there were no words, there were no words. And I just learned a really neat word last week. Have you ever heard the term sonder? No? I had never heard it either until last week. Apparently, it means the emotion you feel when you realize that everyone else on the planet is having their whole own experience of life at every moment that is completely separate and different and like also happening other than you, like it's not yours. And that's happening to all of us all the time. And that is a very powerful idea, which this technique is all about, right? That is an idea, and this is the investment expression of that idea, I would argue, and the innovation expression of that as a business discipline. And why I say that. So what are the principles of how you do social return on investment analysis? There were a bunch of practitioners kind of muddling through trying to figure this out. And we came together and started writing about it. And then the UK government formalized the requirement that they needed social return on investments for some of their grants that they were making to businesses or contracts. And so it got written up in the UK and formalized into a standard auditable methodology. And the steps or the principles are that you involve stakeholders. So anybody who is experiencing an effect that's significant to them should be involved in understanding the changes that are happening. You understand the changes that are happening for them. You ask them how important are those changes to them, which is the way of valuing it. You can translate that into dollar terms if that's useful. And I will talk a little bit about that, although we don't have enough time to get into that too much. You only include the things that are important, and you don't overclaim how much is due to you. You are transparent about how you came up with the analysis and what your methods were, who you talked to and who you didn't, and all of that. And then you verify with the people who are affected, preferably, that you've done it well, or you can submit it for assurance at Social Value International to see that you did it at least according to those principles. And then you respond to what you have learned. That's the 8th principle that just got added a couple of years ago, because this has been an evolving process. So you can imagine that there are steps that would be like any other evaluation, basically. This is definitely related to accounting and evaluation. So, we have some of these where it's a data collection stage. Social Value International prioritizes having the stakeholders voice their own experience, but there are other ways of doing this from a desk, borrowing from other people's research or statistics that might already have been compiled. And businesses tend to like it that way because it's cheaper, but it's not as good. So here's a little example. Can you guys see this? Yeah, your eyes are young. I can barely see that. All right, so if you have patients from, let's say, a disinvested community, and they are investing certain resources to enable your activity to be effective, they're investing their time and their will to be there. We want to record all those different kinds of investments that different stakeholders are making. Then you think about what the company does, and we've simplified that, obviously. And then what are the measurable products and byproducts, which are the outputs of the activities of the company? These are things you're already going to be tracking as a venture. And then you think about, okay, so what changes for stakeholders as a result of those outputs? How have they, like, so what? What changed for them? Was it good? Was it bad? What were all the different things that changed? And hopefully you're asking them, you're sampling from the different stakeholder groups and you're asking them to tell you. And then you ask them, how important was that change to you? And there are techniques for how to do that. The way we actually translate that into monetary terms is very similar to the way Nike determines how much it can get away with charging for its shoes, which is basically how important is this to you compared to other things in sum. And you can associate it with other things that have a market price in order to arrive at a sort of approximate value in dollar terms as one of the ways of doing that. There are many ways of doing the monetization. But you want to come up with a proxy in monetary terms if you are going to translate it into dollars for that change at the level of importance that it is for that person. So this is, there's some sort of technique to this. And then you want to think about how much of what changed would have happened anyway, even without you, and how much of it was due to others, and how much of it might have displaced a change that other people would have gotten, but now you're doing your thing, and so it's displacing them from getting it. So you shake all of that out, and you think about how do things change as time goes by. So do the outcomes drop off over time, or do they continue, or do they grow? And then you arrive at your calculated valuation. Right. So this is a very simplified example. These icons at the bottom, I put there because I want you to be aware that those are norms. Those are the 5 dimensions of impact, which I will mention in a little bit. So out of this, handful of practitioners around the world who were messing with this, and then the UK kind of catalyzed the formation of what was the Social Return on Investment Network, the SROI network. Then in 2014, SROI network merged with another organization and became Social Value International to sort of acknowledge that not everyone is always wanting to monetize things. And now there are 26 networks around the world. It's thin in Africa and essentially non-existent in South America. So if anybody is interested, let me know. But there's a lot of presence in Asia, in Europe, especially North America is totally covered in theory, although we're small. And in Africa, and Middle East, there's a lot of action happening, but that's also nascent. And in Eritrea, thank you. But I mean in Australia and New Zealand. So all of that has been developing for quite a while, but things have started to pick up in interesting ways, and I want to evoke that a little bit as well. In 2016, there was an effort from an impact investment fund called CapRock under the Blue Haven initiative of one of the Pritzker family members to figure out what would a standardized equivalent of a financial statement be for impact data, that all investors could be on the same page and just like everybody knows the layout of the information is going to be the same, so that we can then just get to the information. Because right now, everyone who reports a sustainability report or an impact report is laying it out in their own unique way. You never know exactly where you're going to find the data that you're looking for. And they started talking about this and realized people don't even agree on what the word impact means. So we're going to have to start at square one. So I think it was 4 years, the impact management project of very brilliant people came together and facilitated 3,000 practitioners and impact investors of all different kinds to come around a table and figure out, what do we mean when we say impact? And those icons, what is changing? Who is it changing for? How much is it changing? What's the contribution of the investor to that change or to the company? And what's the risk that our understanding of the impact is wrong? Those are the 5 dimensions of impact that were the consensus from this group. And then the impact management platform kind of was the next phase of this effort. And what it is doing now, which I have the privilege of being a liaison to for Social Value International, is it's getting these different standards organizations together in a room to talk with each other about, like, you know, what of what we're talking about is the same thing and what is different and why, and how much can we harmonize? Is anything actually redundant? Is this like a delicate conversation? But what's interesting is that for the most part, all of these organizations are serving a different use case. What I mean by that is, like, if you're serving a multinational corporation who's trying to understand their impact, most of what they think about as their impact happens inside the company and as an immediate direct result of what they're doing. And it wouldn't have happened otherwise, for the most part, as they think of it. So they don't understand the need to shake out all the steps in between. It's really confusing. Why do you need to differentiate between an output, an outcome, and an impact? And then, tease those things apart. But they've been hearing each other and getting on the same page as the private equity investors, as the institutional investors, whose audience includes pretty conservative investors who are just trying to understand, are we at risk because of something that we didn't look at before, all the way through to, what's the guy's name from KL Felicitas, Charlie Kleisner's, who are 100% of their assets, they are investing proactively for impact and leading the charge on helping others do that. So this is an interesting thing, and you'll notice, I don't know if any of you are familiar with IFRS, the International Financial Reporting Standards. So in the world, there are two financial accounting standards: GAAP, which we use in the United States because we're special, and IFRS, which everyone else uses, although many places you can use either one. You can pick. And IFRS has been an observer to this process recently, because they have the International Sustainability Standards Board that rolled up into them in the last few years, that came out of something called SASB, for those of you who have been following this. Anyway, point being, the accounting profession is not known for, nor does anyone want it to be known for, radical innovation. But even they are figuring out, how do we cope with the fundamental truth, which is that we need to know what effect we're having on not just even the environment, but also on society generally. So it's delicate steps toward that. So the principles of social value are very commonsensical and very much aligned with what the impact management project's 5 dimensions are. And that's true for a lot of these different things. Okay, so we're here talking about valuation of social impact. Interestingly, I didn't know this until I found it out in 2019. There had been a bunch of multinational corporations that were not only doing impact valuation of social and environmental impact alongside their financial performance, but they were publishing it. And so somebody did a study of that, and it's kind of interesting if you dig for it. You might have heard of Caring Group, Samsung, you've probably heard of, Novartis. And you can see that they would find, often they would be finding things that are pretty much this set of things. Carbon emissions, water use, taxes paid, employee education and training, accidents and lost time due to injury, payroll, profits, SOx and NOx emissions, the waste, VOCs, land disturbed, water pollutants, fatalities, and education projects. So it's kind of a mix, but you see a lot of different things in there that are pretty universal and not hard to measure for a huge corporation. I must admit that, like, I started to feel a little bit less imposter syndrome when I saw this, and I had made something that looked like that in 2003. And Anyway, so BASF is one of the companies that published this. And they put it out and then the phone rang and guess who it was? Any guesses who called them when they saw this report?
Samsung.
Samsung? Well, maybe. I'm not saying no, maybe so.
You did.
No, I did not, but I wish I had. Anyone else?
Bill Gates.
What?
Bill Gates.
Good guess, Bill Gates. It was not Bill Gates. It was Larry Fink. It was BlackRock, actually, who said, "Oh, this is interesting. How did you do that? And is there a standard methodology?" No, there wasn't. But if Larry Fink is asking, because it would be useful for him and his asset owners to know the standard methodology that you're using that's going to be the right way to do it, you might want to make a standard methodology. And so that's what the Big Four set out to do with something called the Value Balancing Alliance, starting in 2019. They were hoping it would take 3 years, and they decided to do it in a kind of a small team effort because they're really worried about environmental damage due to climate change. So they wanted to go fast, and the pandemic happened. And in any case, it's now come online, and it is now under the name International Foundation for Valuing Impact, IFVI, which has teamed up with Value Balancing Alliance and also incorporates the Harvard Impact Weighted Accounts Initiative, which was another thing that was kind of similar. So they're mostly aiming at a corporate audience, but they are trying to break down into much more granular detail, valuations that can be picked from. So you're kind of balancing the context that you're in with a predetermined value. So you don't have to talk to the stakeholder still, unfortunately. If we can reduce the cost of talking to the stakeholder, I think that will always be the best way. Although sometimes stakeholders might get a little tired of being asked, so we might start having to pay them. It'd be kind of interesting. All right, so there are these standards which are open for consultation. You can take a look at them right now. And you can also look at Social Value International standards, which are also just being consulted with the public. And you can weigh in. There is something called the Impact Valuation Hub that's bringing these different actors into a similar kind of dialogue as the impact management platform. And so, yeah, so that brings us to healthcare. How are we doing on time? Have any of you ever done anything that was impact valuation in your space, in your domain? Yeah, can you tell us what you've done?
Yeah, it was mostly in the field of startup companies collaborating with an accelerator program in Spain that evaluated most of their startup companies based on impact measurement above financial measurement. So our company was part of their portfolio, and all of our valuation was based on impact measurement with them throughout 2 years that we collaborated with.
Neat. Well, that's very cool. Was that in a health related?
Yes, yeah. Sorry, it's a health specific venture firm, but nonprofit venture firm.
Cool.
Yeah.
So were there any particular insights that you got from doing that you think were beneficial or that were particular to the health space? I'm curious.
I would say mostly in the in trying to broaden your mind on what is important for your company, I think, and like other forms of value that you normally don't factor in numerically, so to speak, but that actually add a lot of value to your company, and then you can, depending on who you're like, which stakeholder you're interacting with, you can bring those up based on how important they are for each one of them. So identifying all those different forms of value in a kind of framework where you can like run it over and over and over to keep growing your view in that sense or insight.
Yeah, that's really neat that you have that insight. So yeah, you can learn more about who you are trying to build a relationship with, whether it's your particular kind of customer, your employees, the regulators, if there are some, and just to have a conversation that's filled with information that's relevant to their decision making. That's great.
So, as part of our training, our look at impact of their technologies on the healthcare system more broadly and use things like quality adjusted life years and nicer, other ways to approximate as opposed to just pure financial return.
Yeah, absolutely. I mean, health has really been a leader in this kind of thing. And I'll talk in a second about how cost benefit analysis and qualities might be something that we can build in, and we do, into social value analysis. But as innovators trying to bring something to market, there's always going to be pressure to serve the easier to reach clients. And even when you are about a health equity innovation, right, there's always that pressure because time is limited, money is limited. So so that is always going to be something that you have to be in a proactive relationship with if you want to embed equity and shared prosperity into what you're doing. Impact valuation can be really quite helpful because it's quantitative at the end of the day. And you can't it's as easily slip and fudge quantitative information. And the calculation that goes into it, everybody can see what those assumptions are along the way. The claim that is made when you do a social impact evaluation of an organization is that you're accounting for everything that matters, right? All of the value that matters is the presumption. And so it's a discipline to try to make that true. And if somebody sees that you've missed something, they will call you out more easily if you've quantified it than if you're just talking about it in other measures, because it's harder to tell what you're actually saying in other measures. So there are some powerful qualities of monetization, even though it often feels uncomfortable because it's this abstraction away from the true value itself, right? And that can be kind of risky. So if we were to take a case like a drug that reduces dementia incidence in the population, cost benefit analysis would be a commonly used tool in the public health world that would look at the direct savings. Most often it would look at the direct savings that would accrue from reduced healthcare utilization to the health system itself and the number of qualities gained by patients. So it's usually used in the sort of public policy making arena or from the perspective of a governmental institution, although not always. So that's fine. And social value analysis with SVI would do that too, would look at those perspectives, but would make a systematic point of finding out who else is affected and how are they affected, good or bad, and then valuing that as well. IFVI, interestingly, also would look at operational impacts inside the organization. And then they also would be looking at some of these external downstream things that are quite similar to social value analysis, but just done in a different technique and less nuanced, less of a context sensitive approach, less of a stakeholder centric approach. So these tools can be used, as you say, to speak to different kinds of audiences. And investors in health innovation, whether they're a for-profit investor, like Happiness Capital is one that we work with, or a philanthropic kind of donor, they will often have their own unique way. Because nobody's making them do it a certain way. It's their money usually, and they don't have to adhere to a certain regulatory regime. But the good ones, in my opinion, will be aligned with the norms and these standards that have emerged over time. And the closer that they get aligned to those, I think the better, because it helps us all to understand when they talk about their impact or they publish something about it, we can tell what method they used and we already know it, and we can then learn from what they've done in a more efficient way. So I put this up here because I think you guys, I don't know exactly what you're doing. I've heard a little bit about it, but Happiness Capital might be somebody that you would be interested in approaching if you have the need for venture money. They have a long-term time horizon, so they're not trying to short-term profit maximize. They actually want to be in business for 1,000 years. Okay. And they have a framework that we help them build called Happiness Return Framework that incorporates elements of valuation. And Johnny Chan, who is the Global Venture Capital Congress chairman, has observed that this approach, the Happiness Return Framework, represents the future of investing. And he's a VC, which I think is pretty radical and awesome. He wouldn't call it radical. Say this is where things are headed. So this is an example, and I just want to show you that it's the radical thing I think about it is seeing actual venture capitalists in conventional VC, recognizing that there are multiple stakeholders who are experiencing value. And if you can see this tiny little spider graph, you can come up here later if you want. The further out, the more value is being created. Microgenesis is a company that's preparing women for in vitro fertilization who have experienced challenges with that. And the other thing to notice is that competitor treatments are also on this map who are not going to love this, might compete and take their business. So they have a possibly negative impact from this. Although I think we don't want to assume that because sometimes the market is big and everybody can be served by the amount of capacity there is. So the point is that your context makes these numbers meaningful. It's fine to say, we create $20 of social value for every dollar invested, but unless you know what that's built on, it's kind of meaningless. And what I have found in all of my years of practicing this is that it's an opening to a conversation with the investor or with other audiences who may not easily access the value proposition that's represented by the kind of work you're doing. And they'll immediately start asking questions, but it'll be kind of in a language they already know, which is, okay, how did you come up with that? What's your time horizon? Did you have a discount rate? What are the various elements of costs that go into the denominator? And then once they've understood all of that, a conversation can be had about, okay, what should we be trying to create? What kind of value should we be trying to create as an economy, as an investment world, as a world of innovation? And you may or may not have heard of the donut, but this is the donut, according to Kate Rayworth at Donut Economics, which has all of the sustainable development goals embedded in it, and many of them are in the center. These are thresholds for society that we don't want to be creating economic outcomes that are in too close to the center of that circle, because it means people don't have what they need to have a decent life. And then if we go outside of that ring, those are the planetary boundaries of the planet's life support systems. So our ability to regenerate life on the planet are dependent on these 9 systems. And so what would be great is if we are operating within those planetary boundaries, so we're not over consuming the planet's life support system, so it can't regenerate. And we're not operating in a way that leaves some people out, and that they're suffering. So if we can do business where the definition of value respects these physical and, possibly spiritual parameters, then let's make all the money that we can possibly make. That's great. But just to make it while killing the planet, I don't think most people think that's okay. And just to make tons of money while leaving billions potentially of people in dire poverty, also, I think most people wouldn't see that as okay. Some would, unfortunately, but it's definitely not the majority, especially if they know it's possible, which it is. I have a ton of tools, and I know that you'll probably get these slides at the end. So I just wanted to say, you guys might already be covering some of this, but if not, there's some steps in how you set up an impact management system that's customized for your enterprise that I would be happy to share with you. And, your purpose is the ultimate thing to lead from. What are you here to do? you may get different opinions out there about what people want you to do. And you have to be attuned enough to know what you're trying to make happen in the world to stay on course, even while learning from what they have to offer. So once you have that defined, you'll be able to have good conversations with potential partners, and you'll be able to discern which investors are not a good potential partner for you, which is just as important. So they want to know, does what you do work to create an impact that matters to them? How do you know it works? And how will their money affect your ability to make that impact? And then how do you plan to manage for impact as you grow? One of the best in the world at teaching this kind of stuff is sitting right there, Melanie Edwards. She's here at Stanford. I want to just quickly speak, since we are in an interesting political moment, to the changing landscape around the terminology of innovation and equity. Some people say that DEI is dead in the United States, at least. And what I'm listening very closely to what's happening, and it's changing. People are trying to figure this out. And I would say that if there is inherent strategic value in including people who have different lived experiences, then it matters. And it's going to be a tough sell, I think, for a government to ever dictate to anyone what should matter to you. And it used to be that, we thought the government should dictate that you should pay attention to social and environmental things. And maybe now it'll be that we don't want the government dictating that you shouldn't. But anyway, I think there are some fundamental first principles for this country that can be drawn on. I am seeing some language shifting. I'm seeing some people say you say the words, you don't say the letters. I'm hearing employee engagement and experience instead of inclusion or equity. I'm hearing census tracts instead of demographics. And I am hearing that net inflows of capital to sustainability as a category of investment are increasing still, even though there's been some pulling back. But cost savings is a safe place, and resilience. I've also heard anti-fragility as a concept that helps us find some middle ground with people who may be coming from pretty different points of view. Valuation is such a middle ground, I believe. The numbers just don't lie. The freedom economy is something that you might want to check out if you're concerned about legal rights around equity and inclusion. So you can see in the deck some of the things that I've been talking about. I think the time to act is now, always. And please reach out if you would like to talk further. And with that, I am a little bit over my time, but thank you so much for the opportunity, and I'm looking forward to talking with you guys.
Sorry for that amazing talk. I think you provided us a lot to think about. I think it's a lot of new information for many of us. So thank you for that talk. We're now going to open the floor for questions to our online audience. Just a reminder, because we have some new faces in the room and for those online, please just say your name and where you're from institutionally or country-wise. As we'd love to also note who's in the room. So I see a question in the room from Anastasia to kick us off, and to our online audience, please be typing in the chat while she answers.
Hi, Sarah. Thank you so much for this presentation. I'm here with Stanford Biodesign, studying entrepreneurs' resilience and well-being. And your talk couldn't be more on point, as we see so many times entrepreneurs' motivations with VC motivations are in a clash, and how they measure impact. I was wondering, you mentioned that a component of your analysis is the percentage of change that is attributed to you. And I'm trying to think of the challenges around that, especially when you measure this longitudinally, because so many other external factors are changing. So how does your percentage of contribution change through that? So I was wondering if you can share some of those techniques. And also when you look at not your direct influencer, but those circles that you mentioned, like the dementia example, like the care workers and all of these stakeholders that are further away from your circle of influence, how do you keep track, I guess, of all those impact measurements on the long run?
Yeah, well, I think that one of the areas of tension with VCs is that they know there's only so many things you can keep track of. right? And so when you start talking about all the other things that matter, they get worried that you're not really going to be able to stay focused and execute, which is legitimate. The amount, like the percentage that's due to you, it's awkward, like with many facets of this, because as we all know, the whole is greater than the sum of the parts. So how do you just break that down as if you can just take that little slice out and then you have the same result, but just a little less? That's not how it works. So it is somewhat more of an art than a science. And I would just say the community of practice are good about transparency in what their assumptions were for the most part. And the collective intelligence as more instances in a certain context get developed and more people think it through for themselves and then they hear what each other did. We're kind of arriving at some parameters around that, but it's early days. Let's just be real. So sensitivity analysis is what to do. You know, see how, if your assumption about what the percentage should be is off, how much does that affect the result? And don't expect that social value results should be as precise as financial results. It's just a different thing. And we need to adjust to what an appropriate confidence in the numbers is and how precise we expect it to be, or else we'll never get there.
We have an online question, so over to you, Atya. Timmy Eve has asked, have you begun to quantify the measurable human impacts on health, well-being, and performance?
Yes, we and others have health, well-being, and performance. So the example that I just talked about, the happiness return framework, is for the purpose of assessing well-being, basically. And it's built for a portfolio of a VC fund that contains hundreds of deals in it. So it's relatively high level, and it's built off of the OECD well-being framework, which was already developed by the OECD, and the PERMA framework, which looks at the subjective experiences that contribute to happiness. So, so those include engagement, relationship, meaning, accomplishment, and the P, I'm forgetting, but PERMA framework, and those two are sort of what we use in that instance. But there are certainly others who are using SROI analysis, including us, to ask stakeholders about their own experience of well-being and what about it has changed for them as they define it. So yes, there are also archives of SROI reports you can get from a database kept by Social Value UK. And you can download them and look at what other people have done. IFVI has a data bank as well of valuations that are supporting their methodology. And there probably are some about well-being in there, although I'm not as familiar with that yet.
I saw another hand earlier.
Hi, Sarah. I'm John, originally from Spain, but also a Biodesign fellow this year. Thanks for the talk. It was amazing to know that, even in the world, VCs and everywhere, it's like there's a topic that has been spoken about. I think in my experience, I find it a little challenging to make this the main narrative, or kind of the overtaking what the main narrative is. Especially, like, an example is like the EU panicking over the last 3 years because their GDP didn't grow fast enough, but not factoring in any of the social value generated. What do you think is is it just a matter of time for this to take over, or is there anything missing for this, these metrics to really become mainstream?
I've been doing this. So what is it going to take for these metrics to become mainstream is your question.
Yes.
Thank you for that. That has been a question that I have thought about, you might guess, because when I started this, I did not think it was going to take this long. I really thought this was going to happen quicker. I see you nodding. And like a colleague of mine who was the guy who helped KPMG create the first sustainability audit for Shell, their big client, of their sustainability report, he thought it was going to take less time also. So what is it going to take? I think a few things, but we need to bring more curiosity about those who are not enthusiastically jumping on this bandwagon. Why not? And I think that we are solid enough now that this is worth doing. And it's sort of, we've figured out a bunch of stuff about how to do it. So we're not going to get blown away if they don't like what we're doing anymore. So now I think we're ready to have that conversation about like, why, what is in the way? You know, what is it that you know is a bad idea about doing this? That's one. So curiosity, a little levity, like a sense of humor, which is sort of a general comment for any socially oriented kind of activisty person. We tend to get a little serious, and it's not as fun to hang out with us sometimes, including, you know, with each other, right? Like we get a little earnest and serious. So a little humor, I think, would go a long way. And I think greater recognition that each individual one of us is the leader who we are waiting for. It's not going to be anybody else. It's just not. And you will occasionally find somebody like Mark Carney, who used to head the Central Bank of England, and he realized this, and you know, he was like a real big shot. And he realized, you know what, there are like 400 sustainability reporting standards out there, and we can't really figure out where we're getting as an investment universe. So how about if all of the central banks who already were in dialogue and meeting came together and decided which one or how we're going to do it? And then we just tell that to everybody. They can do it or not, but like, this is how we're going to do it. And so they did. And now the TNFD is a real thing. And there's also a task force on nature related. So that's task force on climate related disclosures was the first one, I think. There's nature related and sustainability, and there's human and social issue TNF thing. So like it's a good model, and it's helping to coalesce a world that had been really fragmented and wasn't really getting unfragmented. So I would just say, like, be a leader, but like the central banks did, they looked for what was already out there, and they looked at what was good about it, and then they kind of distilled that into a good, you know, collection of all of that. And that's kind of what you see with the impact management project effort too. So that's, I think, the way to do it. Don't just invent your new way that is novel. That's already been how people have been acting for a really long time. And I think we've figured a few things out and we can learn more, but do it and stand strong. I mean, this is the moment that we're in now, is how can we stand in our power saying this is right? This is the right thing to be doing. This is going to be the successful business model in the future. This is, you know, how to mitigate risk. This is how. And you just have to do it in a way that's not overly complicated and you get swamped. But this is how.
I build on that, Sarah.
Please.
We're seeing over time too that when CEOs are seeing, and BlackRock's the world are seeing, that it's you guys that are voting with your dollars, and that's woken them up, right? You know, something that's social or environmental, but you're also voting with your careers, who you're going to work for. And I always say you guys have the best, no bullshit radar, because you can assess what companies are whitewashing or greenwashing. So back to the individual power in this room. And that's already starting to tip over into this. And we're already proven. And when Sarah and I started out in space, way back when, there wasn't proof yet that a product or a service that had an environmental social impact could actually, that could propel its profit. And I think we're proving that out, that it makes business sense to have environmental and economic, or environmental and social baked into whatever you're creating. And that's really been exciting.
Mhm.
So, and she is like, she was at the very ground level watching this whole movement. So stay in touch with stuff.
Thank you. Any other?
Time for one more question if there is.
Hi, I'm Erica. I'm one of the policy fellows and I used to be a health researcher back in the Philippines. So going back to that amazing table that you showed, I noticed that with the outcomes that, you stated, some of it would require a robust data structure already or robust data that not a lot of countries like mine would already have. I'm curious about some strategies with the work that you've been doing in Southeast Asia or even other countries on how to go about the data that is either lacking or we're still building, and how could we, better do that through time, especially supporting or even enabling these data structures that are expensive, take time, take manpower to better inform the valuation that you mentioned.
Yeah, that's such a good question. I do think that the stakeholder-centric kind of impact evaluation is the way to go in that setting. But to your bigger point, an example that comes to mind is the Rockefeller Foundation on energy for efficiency access. And they've invested a lot in figuring out what's going on in the last mile communities of the world that don't have access to electricity yet. And they publish that. I feel like the foundation world, as a whole, has done not as good a job as is potentially possible to do at bringing its information into the public domain where people can really access and use it. But they've got a lot of information. It may be a little spotty and patchy, but I think that somebody who's an information systems thinker could really do a lot of good around that. And, there's also data that governments have, and they just maybe haven't put it in a form that's very accessible. So there's lots of opportunity. And I think with AI and LLMs to help with, finding these things and putting them together in ways that more people can program. Like, you don't have to be a programmer to do programming anymore. So I think a lot of things are going to start to open up about that. And that's a really interesting area. Hope I'll find out what you do with that.
Thank you.
We do have to wrap up now. And Sarah, thank you so much for today's talk. It brought to mind actually an African concept called Ubuntu, which means I am because you are because we all are. And I think that for me feels the real essence of what you're saying, that none of our actions as innovators, as individuals, as leaders are without consequence on another, but also on the whole. And invites us to collective responsibility and critical thinking about what those actions are and how they affect those around us, because I have no doubt that many of you joining in online and here in the room will be those who have profound consequence in the world one day in terms of what your actions are in the innovation and leadership worlds. And so thank you for helping us build a framework just to think about what may be some of the parameters that we can explore to ensure that we're being intentional about the outcomes we have. So thank you for your wisdom. I'd also like to thank our partners and just alert you to some events happening. So the Bay Area Global Health Alliance has actually just launched its new Generative AI for Healthcare in Low and Middle Income Settings report. You can find that on their website. I'd also like to let you know that a few weeks ago, we asked you to do a quick survey after one of our events, and we took your input very seriously, so thank you. The overwhelming input was that you would like more LATAM representation. Being an African, I realize we sometimes bias towards African events as well, but continentally, we have neglected LATAM, so we've actually added an additional series to this talk. This one was due to be the last one for this academic year. But next month, we're going to have a talk specifically focused on LATAM with a group of Chilean innovators, and that will be happening on the 6th of May from 12 to 1 PST, and that will only be a webinar. We won't have an in-person event. So for those of you who are able to join us online, we'd love to have you come join us, and their name is DASIN, the DASIN Project. I'd like to also let you know, for anyone listening online that wants to get more involved, that the Health Equity Center program within the Biodesign Center is looking at expanding and growing. If you would be interested in getting involved or financially contributing, please reach out to me. My email is on the invite for today's event. And then, do you want to pull up the slides, Danny? Thank you. And then for those of you joining us online, I do just want to let you know as well that you can catch all previous recordings on our YouTube channel. So if you just look at the Bay Area Global Health Alliance QR code there, and then the next one is for, there we go. Our YouTube, which Danny has wonderfully put together. You can see all previous discussions. Our last one was not recorded as the speaker didn't want it to be, but all the others are on there. And for those of you who join us online, thank you very much. It's the end of our webinar. For those of you who are in person, please could you remain for 2 seconds behind. You just want to grab a photo. Please feel free to get some more snacks and chat with the speaker. But for now, I'm going to close the webinar and ask Sarah if you can take a seat there for a photo.
Yes.
Thank you.